Dr. Gunjan retrieved the oocyte, embryos are made. Now we have to put the embryo inside. All the process of ileati, this is the last and most crucial step of embryo transfer technique. It is an easy procedure. It's a no long period to learn, but most crucial step. Why? It should be gentle and non-traumatic. And what three things will affect our embryo transfer? That is implantation capacity of the embryo, endometrial receptivity, and embryo transfer technique. All three things. Now first, it means both collaboration of the embryologist and clinician needed for this. In laboratory part, what type of embryo, grade 1, grade 2, grade 3, which embryologist has selected, handling of the embryos, loading method, blood or mucus on the tip of the catheter, duration of the embryo loading and medium, all these affect embryo transfer and our end result. Now clinical part, preparation of the endometrium, seeing for endocervical angle, uterine contractions and catheter insertion and which type of catheter. These all affect our embryo transfer technique and finally our end result, whatever we are doing from beginning. Now coming to laboratory part of embryo transfer, if we have to increase the implantation, then we can, if there is patient with recurrent implantation failure, we have some procedures like PGT and assisted hatching and embryo glue. PGT-A is done in cases of advanced maternal age, recurrent implantation failure, recurrent miscarriages and in severe male factors. When we can think of, we rule out aneuploidy and use the euploid embryos. And today, in today's era, non-invasive pre-implantation genetic testing is available there. We're taking cells from the culture media of the embryo. Now, assisted hatching can also help us in implantation. Like zona pellucida is thick, more than 37 years age, recurrent implantation failure. Then we can use laser for assisted hatching and we can increase the implantation with the help of assisted hatching. And embryo glue is one media consists of fibrin, sealants and glycoprotein hyaluronate and could enhance the embryo transfer and prohibit the embryo expulsion. But it is associated with increase in multiple pregnancy rate when transfer medium was supplemented with hyaluronidase, and so not practically used in day-to-day practice. And some studies say that success rate with embryo glue or without embryo glue is almost same. And now we have selected a good embryo euploid with embryo glue with laser hatching. Now coming to the next parameter, that is endometrium. Endometrium is dynamic tissue and endometrial receptivity changes with the period of cycle, and that is known as window of implantation, that is from day 19 or 20, and this is for just 4 or 5 days. So we have to see for P4 levels, and ERA test is for that to select our endometrial window of implantation, and we all are looking for thickness, pattern, volume, Doppler of supply of the endometrium, zone 1, zone 2, zone 3. Now finally our